I'm a skin restoration specialist in Newport Beach, California. I'm going to showcase for you guys tonight an acne scar result. As a patient who's gone through a lot with his journey. He did a lot of treatments before he came to me and really was not too happy with where his skin was. So I want to show just his process and his progress and what we're going to be doing from here at this point on. So I'm going to show you this right over here. You could see for those just joining us, I'm Dr. Qazi, and we started this process back in May 2024, and you can see over here October 2024 where we're at right now. So take a look at this, and we already are getting really great improvement in his skin quality. And the other thing that the patient was really worried about was his pigmentation. He had done a lot of procedures before in the past, and today he messaged me saying that his pigmentation is significantly improved now at this point, and he's super happy with that. So really happy. Just he had a long journey. I'll kind of go through that as more people join us right now. I'll wait for everybody to join us. Hi Martin, how's it going? I'm going to showcase for everybody just really this process and what to kind of expect when you have done treatments before, what I will do differently, and how I could do this really without aggravating some of the pigmentation that the patient was worried about. So I'll kind of wait for a few more moments for everybody else to come in, and then we'll talk a little bit about that. And it's a really nice case. I think it's something that when we look at this, it's kind of interesting because he had done, I believe, 1, 2, 3, 4, 5, 6, 7 treatments before he came to me. I was just pulling up his notes right now. So 7 treatments before he came to me for his scars and also his pigmentation. And it just, we improved it a lot. So it's really nice. I want to showcase that for you guys and kind of tell you a little bit about what this was and how we did that journey. Hi Joey, how's it going? And kind of just to see what's necessary for some patients when they have a scarring and they sort of feel like they've hit a plateau. Like sometimes we just have to take a look and see, why did that happen? What do we else we need to do to improve the scars? So in this particular case, this patient had done elsewhere. He had done Bellafill, microneedling, subcision, and then he did follow up with more TCA Cross, and then he did some phenol cross, subcision, and then erbium and filler, and then he did another round of doing phenol cross, subcision, erbium, and filler just after that, like about 6 months after that. And then after that, he did some pigmentation procedures elsewhere. So he did a lot of different things. I think he did most of his treatments down in San Diego, and several times he did this combination session that they do over there. And just was finding that it wasn't enough really. He felt it improved somewhat, but it really wasn't enough, and that's why he came to me to really kind of go through and really improve it to the level that he wants to get it at. He's somebody, I consult him a lot about this because he was somebody who really wanted more perfect results, as close as possible to perfect for him. And he's been really seeking that for a long time. So I was telling him that really it's not really going to be perfect. It's just what I'm going to try to achieve for you, though, is that it's less visible for you. When at day-to-day settings, I want it so that you're not noticing as much. I want it so that it's really only under certain harsh lighting that you're going to be noticing the scars. And he's been texting us a lot, actually, back and forth, was saying that he still saw some scars initially. And then I saw him just a few weeks ago, and it's like, I'm finally at the place I need to be. And it's awesome. It's like we were able to achieve that. The way we did that actually was we did a few things. I did subcision for him, even though he did subcision before. I know because I've done subcision after the previous doctor before had done it. I've noticed before that there's still usually a lot of scar tissue there. So I ended up doing subcision for him and broke up the scar tissue, really lifted up that scar tissue really effectively. There's a lot of scar tissue still in there. And then we actually ultimately also did his forehead as well. And then we actually did a fat transfer for him. We did fat transfer. We also did laser too. And then we also ultimately did a little bit more Bellafill for some of the remaining bits of indentation for him. Really happy, amazing improvement for him. and better than anything he ever expected, I think, at this point. So it's like it's really, really nice. For this patient, I did feel that his skin was very sensitive. That's why I didn't want to initially just right off the bat just go and laser him. I really wanted to make sure that the laser was going to be justified at a certain point. So I broke up that scar tissue and wanted to really make sure that when we do it, it's going to make a lot of sense for him and let his skin heal. And we ended up also helping with his redness, his discoloration. So we first did a little bit with XLV laser, and that helped a lot with his redness. And then we also did something called the Pico laser, which helped with his brown pigmentation. So we did all that together, which, significant improvement. And there's also more collagen production when you do the Pico laser too. So it's less, those things all help out with that too. Phoenicia is saying, do you do PRP or anything for receding hair? We do a lot with that, actually. We do a lot with PRP. You could join our program for hair on our website. Just go there. Our prices are on there. I really made it very, very competitive because we do the platelets. We get a very high concentration of platelets, but I don't add anything extra. I never found that there was any benefit to adding extra things. A lot of people say that you should do. I've been doing it for 5.5, 6 years now, and I didn't find that there was any improvement by placing extra things in there. And it was just ultimately just more expensive than it was worth. So I made it so that's super valuable for patients. And it's something you could do monthly. That's what you should do, really. Just do it monthly and just keep up with it. And you're just going to improve your hair. First thing you're going to notice is you're going to have less hair loss in the shower. That's one of the biggest things that people notice. When I was experiencing more hair loss, I found that it was just a lot in the shower. I was just getting these clumps of hair in the shower. And then I ended up doing PRP. Helped a ton. That's not the only thing that I did, though. I was on Rogaine for a long, long time. I don't think it was particularly effective, though. But I did ultimately then switch over to oral minoxidil, which ended up helping a lot. So I did oral minoxidil for a while. Still felt that I was still getting hair loss, though. So it wasn't enough. But the PRP was really the thing that protected it and made sure that, like I said, in the hair in the shower, there's no longer those clumps of hair. I find that's thicker right now. It's just a lot better for me. So I love that. It's really nice. Let's see here. I know I missed a few things here. Johnny SD is saying, would the sunlight affect the skin after treatment? Yes, definitely. You absolutely would. And that would delay your collagen response. You have an inflammation there in your skin, and you potentially aren't going to really get the collagen development that you would want to get. Let's see here. What's your go-to for pitted scars? Well, it depends on what kind of scars they are. If they're ice pick scars, probably TCA Cross or maybe excisions. It just depends on how deep they are. George is saying, can you remove stretch marks? Yes, we could improve them, not remove them completely, but we can improve them. Usually the way I do stretch marks is typically with a lower energy laser with a pro-fractional erbium laser works really well. And then I usually use a dilute form of Radiesse, either injected or topically. So through the laser channel holes, I do that, or both, just depending on how deep those stretch marks are. How many treatments? This patient, we did a few treatments on him, but it wasn't the same thing. Initially, I did some subcision for him. I also ended up doing, we did fat transfer for him as well. We did some TCA Cross for him. And then we subsequently did some laser to resurface the area and some Bellafill as well. So we did a few different things. It wasn't just the same thing at one time. And then we did a lot with the Pico laser for his pigmentation and his redness. He had a lot of redness there. Martin's asking, can you talk about mesotherapy? Yeah, so mesotherapy, I've been doing it for a long time, about 6 years now. Essentially what we do is we put in an ampule, we put some Botox usually or some sort of neurotoxin like Dysports, for example. And then we also put some filler in there as well, just a little bit of hyaluronic acid just to replenish the skin. We could put a little bit of nutrients in there, some vitamins. A lot of times I like vitamin B12, for example. It helps a little bit with brightening the skin. We could also put a trace amount of tranexamic acid sometimes for some patients with melasma. And a lot of times, actually, it is one of the things that people do love is with PRP. Put a little bit of PRP in there, and pretty much everybody universally says that it does make their skin quality feel a lot better with that. So something to pay attention to. When this patient came in this day, actually, for this photo, we ended up doing our mesotherapy treatment called Microgold on him, and he loved it already. So it's awesome. We followed up with him. He's feeling really good, and we saw him just like a few weeks ago. Let's see. Smiley face saying is, when you say percentage of Bellafill stays, where does the rest go? It migrates? No. So basically, Bellafill is 80% bovine collagen and 20% PMMA. And essentially, the bovine, the cow collagen, goes down. It gets absorbed by your body over the course of really like 3 months. So essentially it's a little bit lifted initially and then it goes down. And that process is a little bit concerning for people because they look at it like, oh my God, the filler is all gone. And some people get tricked and then they try to overfill then in that time. I've been doing it for so long and I'm very, very comfortable with it that I know how I could essentially gauge the dosage for patients. So sometimes we would just wait it out. Sometimes there's a lot of volume loss. We could place something in a certain layer just to help support the scar tissue as it's going down. But it all depends because we want to essentially have it so that your own body has its own natural collagen response around the remaining 20% of PMMA. And it always does. It's awesome. Everybody universally, in fact, a patient that I came in today, I haven't seen her in 2 years, and I did it actually for some of her crow's feet because some of her crow's feet essentially were also, it was actually what she was referring to as crow's feet sometimes, was basically some volume deficit in the cheek, in the lateral cheek area. And now today, 2 years later, it still looks beautiful. It still looks amazing. The skin itself feels more firm. So that's what you could do with something like Bellafill. It's very, very different than traditional filler, where traditional filler will just go down and and just essentially disappear over time. Bellafill will continue to integrate with the tissue and make collagen. I should say though, actually sometimes filler, if it's too superficial, it could stay there and continue to stay there and not develop any collagen, but actually stretch out the skin and cause some puffiness over there. I do so much dissolving, so much with that I see that all the time. Essentially, pretty much every single day I see that problem. And that is something you don't run into with Bellafill, which is really, really nice. It doesn't draw in water. So it's really nice because what you get in there, you get to keep. So it's really nice. It's stimulating your own body's collagen. Thoughts on Potenza? It's good. You know, I think that we just have to be careful with it. Just with all radio frequency microneedling devices, essentially you could overheat the skin. You have to be really careful with the layers you're doing it on. You know, something I take a look at all the time too. I'm open to using Potenza. I have no problem with it or anything like that. So to me, it seems like a good device. I wouldn't push it for scars really ever. I never really push radio frequency microneedling devices for scars. But for like skin tightening, I think these devices are good. I think it's good. They're good for skin tightening. You know, the jowl area is really, really nice. The neck area, they could be really nice. So for that purpose, I think it's good. And just a little bit with like the texture, just making the skin look a lot better just visually. I think people find that that's the case, that their skin just over time is looking better and better, which is nice. But you do want to combine things. You know, usually want to combine things a lot of times with like a topical retinoid, things like that. I'm not saying like do a bunch of stuff. I'm not like someone who's saying like do a bunch of skincare things, all that stuff with it. But like, you know, retinoid, things like that, or pigmentation, those type of things you probably want to do. Can you do phenol peel on 20 milligrams of Accutane? No, you definitely would want to wait for that. Your skin is going to be red as a tomato after the phenol peel. You absolutely want to wait till later on, potentially 6 months, even a year later after Accutane. Let's see here. How far apart are these pictures after the procedure? So our first set of procedure was done in May, and now this is October right now at this point. So and now is actually really when he started to notice more of that difference. He actually, up until this point, was saying, I just don't really see much of a difference. And he was telling me that all the time. So it's really nice that we finally got there. You know, it took some months, but he was really, really good with following all instructions. You know, very, very great patient, really, really nice gentleman. And but he just also had a great collagen response too, and you can definitely see that. Hillary's saying, what's the difference between Fraxel and Pico? Which do you think is better for hyperpigmentation? Hyperpigmentation by far requires lasers that don't generate too much heat. You really can get more rebound pigmentation issues with something like a Fraxel laser. So my go-to typically is going to be the Pico laser. You could also do something like broadband light or IPL, something like that, but usually you want to go pretty low energy for that. It's not as effective in darker skin types or Asian patients. I find Pico laser is definitely the best though. And really I had a patient today who had underwent an IPL somewhere, and she said that she had a little bit of melasma, and then now it's just like a raging amount of melasma almost her entire face. And she said it was just really from the photofacial that she ended up doing, which is really unfortunate. You know, so somebody did that to her when she had melasma and she was Fitzpatrick 4, Hispanic descent. Really unfortunate that happened. Let's see, your smile is saying, how do you know if somebody has sensitive skin? Well, you could go and test basically occasionally if you just feel like a patient's skin, you touch it and a little bit and it rebounds a little bit with redness. Sometimes that's the case. You should just talk to them and ask them though. Not every patient that's what happens to. I would say most of my patients, most of my acne patients, most of my scar patients have sensitive skin. So I'm really comfortable with sensitive skin. Let's see here. Yeah, I know I missed a few things. I'll try to hit that right there. Michelle is saying, is there an alternative to tightening under the skin without doing a lower bleph? Well, if it really is that you need a lower bleph, that's a little bit different. But if it's mild laxity, then a laser could work. Like CO2 laser works really well there. Erbium laser could work really well there. And sometimes Morpheus 8 or some sort of radio frequency microneedling device could be a good idea for you. Let's see here. Brandon saying, I love doctors. Appreciate you, Brandon. Thank you. Let's see. Priya saying, do you think PDO threads could create a flattening effect for acne scars, not appear as deep? I think it could help, like with the stretching process. It could be that it does improve it a little bit. I just don't find it to be worth it because the problem is that it's just too temporary of an effect. I do worry sometimes about a little bit of scar tissue that could happen with it if it's a little bit too superficial. It could get stuck a bit. It could cause dimpling too. So I wouldn't really say it's my go-to for that. Smiley saying, thoughts on red LED panels for brown Indian skin? You're right to question because sometimes it could cause a little bit of hyperpigmentation. So it's possible you have to, it depends on how much power and energy is coming in from those light bulbs though. And I mean, you have to kind of wonder, do you really need it? I'm not sure what you're using it for, if you really need it. Dan is saying, what is the best thing to do for fraxel damage? So in fact, this patient had a little bit of that. He had a little bit of like a prolonged redness after his multiple sessions, which he ended up doing in San Diego with lasers. And then he ended up doing a harsher peel kind of soon after those lasers too. So, he went to somebody in West Hollywood then who ended up doing a peel. I think also did a bunch of skincare products for him too and things like that. And he found it just really made his skin really, really sensitive afterwards. So what I ended up doing for him is, first of all, you want to stop a lot of the products that people are doing. It's like people are using a lot of harsh chemicals, a lot of different things. And it's unfortunate. Sometimes people spend a lot of money in these things, but you really have to just wind that back and make sure that you could just basically start from kind of reset it. And a lot of things, what I do is usually I just do really basic like moisturizers. I just do like Vanity Cream, CeraVe, Cetaphil. Everyone thinks it's crazy. I tell patients do CeraVe, Cetaphil, and they look at me like you're crazy. Like it's like, what do you mean you're not going to use like medical grade lotion? Like what does that even mean? Medical grade lotion. That word is just made up. There's no such thing as medical grade lotions. There's not even really a medical grade skincare thing. There's certain things that are prescription strength, like retinoids are prescription strength. Hydroquinone is a prescription. But it's really disingenuous to claim that certain lotions are medical grade. I don't know what that means. It's so illogical and really it's manipulative. It's manipulative language and it's really unfortunate when people try to push that thing because Vanity Cream actually works very, very well. CeraVe could work very, very well. So I like those. Those are typically my go-to ones. And I recommend those for patients. And like, that's what we ultimately did for this patient. We ended up just like making it really streamlined and really clear. And then what I ended up doing is more for his regular pigmentation using our pigmentation cream. And then we used a bit of Eucerin's anti-pigment cream for some more sensitive spots because I do find the Eucerin anti-pigment cream is a little bit less irritating. So I did that for as well. So, and then combined with a little bit of like the Pico laser and XLV. Worked out really, really well for him. Repaired his damaged skin barrier really well. And he did have a bit of a damaged skin barrier. Minus Forever saying, can you remove a bunch of skin tags? Yeah, it's actually really fun. I could definitely do that. What treatments did you use on this patient? Oh, thanks so much for asking, Monica. So for those just joining us, I'm Dr. Qazi. I do skin restoration. I'm over in Newport Beach, California, and I do a lot with acne and scars and pigmentation. With this particular patient, we had to do a few different things because his skin was actually really, really sensitive, considering the fact that he did so many different lasers and peels before. So when he came to me, he was asking to do a laser right off the bat, and I really wanted to push that further down. I wanted to improve things though because I knew that there was still an element where the scars were tethered down. Even though he did subcision 3 times before, it was pretty clear to me that I was still stuck. So we did subcision for him, we did fat transfer for him, we did TCA Cross for him, and then later on what we ended up doing is we did some more laser for him and and then we also did a little bit more Bellafill for him. And that's actually really pushed things over the edge. So we started the process in May and we're now in October. And usually I think we spaced it like for those treatments. I think we did the first, actually I could pull it up. We did the first session back in May and then we did the next session I believe in June. So yeah, sometime here with the healing process, I wanted to make sure that everything was settled in there really, really nice. And then when he came in this day, we ended up doing mesotherapy for him to really improve his skin some more, and just fix his damaged skin barrier a little bit more. So we ended up doing that, and plus a little bit of the Pico laser. Worked out really well. He just messaged me that things are looking really, really good for him. Brandon saying, I will be booking with you very soon. Awesome, Brandon. Appreciate you. You know how to book with me. You can go through my website, drqazi.com. Just book a consultation that way. I'll be happy to help you out with that. I did a lot of virtual consultations today. Also, a lot of follow-ups today. Those guys that followed up with me, really appreciated you guys. Everyone was saying really nice things about their skin already. So it was always fun to see. Really fun for me. What do you think about ice pick scars? They could take a long time. They could take a long time to work, but they ultimately do work. It's just slower than people expect. You will see some of those superficial scars really do improve. The deep ones are just going to take a long time. It could take like 2 years sometimes for some people. Who is a good candidate for subcision? Well, if you look at your scars and kind of I wish the patient that I saw today, I did a consultation with him. And he was basically a really, really great candidate for subcision, a 21-year-old gentleman. And when he smiled, you could see that the scar was really pulled down, and his smile was basically bending his skin. Basically, you could see the folds of his skin around his scars. That's classic for needing subcision. Not everybody has that severe scarring, but that is a very, very classic sign that I'm looking at. So when you come to me and you do a consultation with me, a lot of times when you're especially we're ready to do a treatment, things like that, I'm having you smile multiple times. It's not because I'm just trying to make you happy, although that's part of it, but I'm really trying to just test the areas to see where the tension is. I want to see where it's pulling down, and that's what the area that I'm going to localize, especially a lot more of that with the subcision. So that's the process with it. Triple X saying, do you think old lasers are better than new lasers, or is it all about whose hands it's in? Well, I don't really think there's much regarding the difference. I should say, let me put it this way. I don't really believe there's too much of a difference between different lasers for CO2 lasers, for example, or even certain erbium lasers. I really don't know if there's that much of a difference. I love my SiTime pro-fractional laser, the Jewel. I do like that. I like the handpiece on there. I think it's really nice. But CO2 lasers, I think there's a lot of it could be interchangeable. And sometimes I know there's some patients who will message us things like that, and they'll say, do you have this laser? Do you have that? And it's really not about the laser. It really isn't. I mean, yes, sure, we have those lasers. We have a lot of different lasers. We have like 27 different lasers, but we're not really obsessed with a brand for the laser. It's really about how we're doing the laser and if we're doing it appropriately for the right patient. That's what it comes down to. Real picture. Let's see here. Do you think? Oh, I know I missed a few things here. How do I keep a keloid from forming? I can feel it coming. Well, you want to use silicone tape. Silicone tape is probably one of the easiest things to do, really. If you use silicone tape as much as you could, it's going to help prevent friction. So really consider doing that. The silicone tape, especially at nighttime, really going to help keep the scar flat, so that way it doesn't actually rise, especially when you're at night, you're in your bed and you're kind of rubbing your face a little bit. Sometimes that friction can cause can cause a keloid. Keloids really do happen with friction. That's where it more commonly occurs. So pay more attention to that. Exo is saying, how long does Bellafill last after all the laser treatments? So 20% of it's always there, and then it continues to make collagen. That's what's really, really useful for Bellafill. It's going to continue to remodel and restructure your scars, and so you always have some support there. So that's really nice for patients, because a lot of people essentially when they do these treatments, they want things that are going to last. Really, when you come to me, like this Pico patient, he did so many different treatments, and he really wanted this to be like the final solution for him. He didn't want to do a bunch more things afterwards. He went through so much and really felt like he gave up until he found me. Really, that's what he said. He's just like, up until this point, I really did feel as if that there was no more hope for my scars, because he was going to scar specialists, and he just felt like he was plateauing, just wasn't really getting what he was trying to achieve. A lot of things actually were related to the fact that subcision needed to be done a certain way. He needed more volume, really. So those are things that we try to focus on. And then, of course, we still wanted to restructure the scars. So we did some TCA Cross and did some more laser. But doing really proper, effective subcision, super, super important for patients. Doing things for volume, fat transfer in this case, really, really important for the patient. So those are things that really ultimately mattered. But I do know that patients sometimes get tired. It's like he did so many treatments, 7 total altogether with all the things he did, and it's like it's exhausting for people. I do want people just to feel like when they come to me that this is it. That's what this is the end. I want it so that they finally have reached the end of their journey, and that's what this patient has now. It's really nice to see. It's like he's beaming now. He's so happy. And honestly, up until this point, I've been seeing him multiple times and doing follow-ups with him and doing, he sometimes comes for Botoxing with that. And it's like, he still was just concerned. He just felt like, I'm not sure if it's going to happen or not. And like slowly, he's like starting to see it. It's like, it's all coming together now. It's like, yes, actually, I do see that the skin. And I was explaining to him that some of it was just the redness. The redness was making it seem as if his scars were worse still. So just let's calm down the redness first. Let's first wait for that process to occur before. And he was like, do I need to do more lasers? And I'm like, no. Let's wait. Let's go patiently. And now we're here. And now we're at this point where it's like excellent, beautiful results. And he's smiling. He's super happy. He's like stoked. His confidence is up. And I love it. I think that we're finally at this place for him where his skin is really under control. Now he can worry or focus on other aspects of his life and really just move on from this whole chapter. Awesome. That's an awesome feeling. Imagine just going through journeys of a long journey, thousands and thousands of dollars, 20-something thousand dollars worth he spent before he came to me. And it's like finally now he got the results that he finally got. Makes me happy. I like it. I could be able to talk on here and do and explain it. And he sent me a message today saying like how happy he was with it. I was like, it made me happy. So it's really nice to have that. Sometimes it's slow. It takes a little bit of time. I do think this is maybe a little bit faster, though. I do think that this may be a bit faster than some patients, because it's like, he followed everything I said. He did exactly what I said I would do. Every time I saw him, he was never tan. He was always like clearly had so much sunblock on his face. So he did everything, that's why he helped. That's why he got so much better. Tony Santana is saying, how long after I'm done with my Accutane treatment should I book an appointment? You can book it now. Well, I'll be happy to take a look and see. Sometimes I could do it while you're on Accutane even. It depends on what we have to do for you. Just book it now. We could take a look and see. I know I missed some questions over here. Where was I? Subcision downtime. Most subcision is about 4 days. The way I do subcision, usually about 4 days of downtime. Let's see here. I saw that on TikTok where you lifted the skin and placed a tool inside. What was that? Very scary. That's subcision. But it's probably subcision. It's not too scary, honestly. It really looks worse than it is. If you're somebody who's squeamish, don't watch the videos. But actually, it's not painful really at all. There's so much numbing in there. Nobody feels any pain with that. So I think that it looks a lot worse than it really is. Why do burn patients keep getting a high fever? So burn patients, it's an inflammatory process typically. You're basically a terrible state, especially if it's like third degree burns, which I worked at Cook County Hospital in Chicago, which is the #1 burn center in America. And essentially, one of the big things you are trying to combat is really not just the burn aspect of it, but the infection portion of things. Because normally burns, sometimes, especially if they're extensive burns like that, they could cause fever by itself. And you're worried now in a setting like an ICU setting, for example, is there underlying infection? Burns, especially third-degree burns, are really prone to infection. So if you are somebody who is having fevers with a burn, we have to rule out infections. Of course, burns could be just the inflammation that could be reason why you have a fever, but there may be an underlying infection. So sometimes you have to get blood cultures. You have to take a look, of course, at your wound, at your burn. You got to double check to see what's happening and really rule things out before dismissing it as just due to the burn. And a lot of times you don't just really like chase these things, just the symptom. You try to figure out what the underlying cause is there. What is actually happening? What's the state that the patient's in? And you take a look at the lab, see how the white count is. Is it going up? Is it going down? All those things. And I'm not sure what kind of burns you're dealing with or how extensive it is, but there's a lot involved with making sure burn patients heal appropriately and safely. That's, something I actually personally love to treat. I like treating burns. It's a patient that I'm working on right now. She had a lot of burns extensively on her hands. She isn't a cook, but she works with like hot pots, she was saying. And essentially it burned her. I guess there was some liquid there too nearby or something. And it burned her whole forearm. And she has so much pigmentation, so much burning. Really, really significant improvement though at this point though. So it's really nice. Although then at work last week it happened again. She has a new burn over there. So now I have to work on just making sure that gets better. And the new burns, we could do a few things, especially with just using topical lotions, especially like Vanity Cream works well. And then you could do like something like a silicone tape to help prevent that from scarring. So that's usually what I usually would recommend after the first week or so. Initially, it's more like what we call wet to dry gauze. That's usually what you do, but then afterwards you could do something like silicone tape. What did this person get done? This patient, we did a few different things. We did TCA Cross for him. We did subcision for him. We did fat transfer for him. And then we also did laser. We did, in his case, with those rough edges, we did a fully ablative laser for those areas. We did fractionated lasers as well. And then we also did some Bellafill for him. Let's see here. Haley's saying, does TCA Cross make the appearance of ice pick scars wider until you get a few more treatments? It's possible, but usually just a little bit, a short period of time, not for prolonged. Carlos is saying, hi, Dr. Qazi. How many PRP patients have you worked with going balding? Actually, a lot. I'm not sure offhand. There's a lot, basically. I don't even know. There's a lot of patients, though. Interestingly enough, I would say it's not even just all men. It's actually probably 50-50, men and women. Maybe like 55-45. But it's like pretty much like there's a lot of women who do it as well. It helps a lot actually too for women, not just necessarily postmenopausal women, but some women just are losing hair due to some stressors or other factors that occurred. And now that's the way we could catch up with it. Priya is saying, what do you think of PRP microneedling for acne scars? Pretty ineffective for acne scars. It's okay for the healing process. It could help you heal afterwards, but it's really not going to help much for acne scars really much at all. In fact, I've even talked to some people before who actually were recommended PRP for their acne, which I think is really unfortunate that someone was pushing PRP for their acne. And then, there's some people who had like cystic acne and someone's saying to do PRP for their acne. Really, really terrible, actually. I think that's really unfortunate that someone was doing that. I think it's really unethical, and it potentially could have led to more scarring because you delayed appropriate treatment for that patient. Let's see here. How long after scar treatment do you recommend avoiding makeup? So the thing with makeup is that it overly dries the skin, and as it overly dries the skin, you could get more rebound oil production, which could cause it to break out. So that's my issue with makeup. So at least a week, but try to avoid it even more. Just try to do that. I want you to avoid makeup if you could. Michelle is saying, for fat transfer under the eye, do you overfill slightly? How do you know how much will be absorbed? Very slightly. You would overfill very slightly if you're going to do it that way. And usually what you're going to do with that more likely is going to use more nano fat, which is basically the stem cells of fat. And you're going to re-inject that to help improve the skin quality. So that's usually what you end up doing. Thoughts on PRF for scarring? Really not going to help much at all for scarring. It could help with the healing process, but not going to help much for scarring at all. And I really hope if you guys got anything out of this talk tonight, I hope you guys got that essentially if someone's pushing microneedling for your scars, this patient, someone did microneedling on him too, it's not appropriate. It's not appropriate for these kind of scars. It's really, I think, unethical to be pushing microneedling for these kind of scars. There's a lot better options for patients, and they should be offering that, or send them to somebody who could do it for them. If you can't do it, send it to someone who can. There's a lot of things I don't do. I send it out, or I was like, this is not something I could that I work on, and it's okay. There's certain things that's like sometimes it's like not your specialty. That's okay. Everybody should be specialized. Everybody should do a few things and do it really well. That's what I like doing. Actually, that segues us into our next question, which is Smiley Face is saying, do you have any advice for studying, learning, focusing? Sorry for off topic, hopeful med student one day. I'll give you a tip, actually. If you want a tip, I'll give you a tip that I think helped me out a ton, which is that when you are doing something and you start to lose focus, you should try to look at your hand and try to refocus it. And basically what I mean by that is like, see that it's not shaking, it's not tremoring, and try to focus on that again, reset yourself, and then go back to the task. And now you should be back into your zone. And if you feel like you're not back into your zone because something else externally has distracted you again, do that again. Find something that you could kind of like just focal point. Like if that's like a pencil, if that's, even just like a clock, you're looking in the distance or something like that. If you can't do much else, you're taking a test and you just can't focus that well because like some kid is crumpling a piece of paper next to you, or chewing gum, or being, obnoxious and annoying. Yeah, this is your way to kind of recenter yourself and then go back into to what you're doing. I'll tell you honestly, it took me a long time to realize that. It took me a long time. I had to study and work extra hard, harder than a lot of other people sometimes I felt. I found that like it was like just really tough sometimes because it was like people were expecting you just to memorize textbooks, and it wasn't my way of learning. I didn't learn just by memorizing stuff. I learned by doing things. I learned by like using my hands. And it was like the way everything's taught was like, just here's this textbook and just like kind of go into the textbook and remember that page. And if you don't remember what was said on that page, you aren't going to pass that class or do excel at that class. And it's kind of interesting because sometimes the people that end up doing the best at those type of things really, didn't end up actually having the skill set to be able to do things like comprehensively with patients in front of them. When the patient was in front of them, they sort of would just not really be able to break it down as appropriately or understand exactly how to treat this skin condition or their medical condition or whatever else was happening in front of them. But they're really good on paper. If it was a textbook question, then they could answer the textbook question. Patients in front of them, now it's a little bit difficult because it's not fitting exactly what that text question was. It's not fitting exactly what the textbook said. And it's like very, very confusing for people. So it's like sometimes, the skill set that seems to succeed for school isn't the skill set that actually succeeds in real life. So don't feel discouraged. I tell people that are thinking about going to med school or thinking about going to anything, like really anything, if you found that like school was difficult, it's okay. It's just because school kind of sucked, honestly. It really did. And it's like school, a lot of times it really like, you have to do more than what school is doing. You have to actually like really understand the material, and sometimes it takes a little bit more work. Do it at home and and absorb it really like with your hands and build something with your hands, like draw things out. Like for anatomy, what I used to do is literally draw out the muscles and just draw it out back and forth. And that's what worked out for me. Like it wasn't until I did that I actually understood anatomy really well. And I wish that was kind of taught that way. I wish that's how, that's what they expected us to learn. But every single person's different. I get that. But certainly just memorizing from the textbook didn't work out. Otherwise, our healthcare system would be a lot better in this world. There'll be a lot less problems with all these people that claim that they're in the Ivy League and doing all this stuff. I think that really it's like, what did a lot of these guys really accomplish? What are they really doing with their Ivy League degrees when, textbook wise, they're great. But in the real world, what are you really pushing? A lot of times they're just pushing still Adam Smith nonsense type of things. It's like let the markets trickle down kind of nonsense stuff with things. I read that in a textbook that the market's going to correct itself and the market's going to trickle down and all that stuff. And it's like, dude, look at the real world today. Does that seem like it's actually happening right now? Do you actually see that actually occurring? It's like, oh, this is what it says. So the book said Adam Smith said this and blah, blah, blah. And it's like, look around you. Clearly, that's not the case. Clearly, what was said in the book was not the real world. So I don't know why you can't understand that. But I'm sure you went to Harvard. I'm sure you went to Stanford or wherever else you went. But there's a big gap with common sense with you. So it's sometimes just don't be discouraged by the fact that there's a bunch of people in your class that may potentially be getting better scores than you and everything else, because ultimately, as long as you could kind of put things together really, really well, you could excel at a very, very high level and potentially even more than them, because a lot of times you just don't have as much common sense as you may think. Josh is Radiant Medical Solutions is saying, how aggressive do you usually go with CO2 laser for acne scars? What's your go-to for combo treatments? I usually don't go that aggressive with lasers. Honestly, I usually don't go that aggressive with lasers. It's usually not that aggressive. I actually have a full, you should actually watch it. Everybody should watch it actually right now. Well, I don't even have to watch it right now, but at some point there's a YouTube video. I'm really, really proud of it. Really happy with it. There's a whole YouTube video that I have. It's a very, very long acne scar session. You can actually just watch it. I think it's like 18, 20 minutes worth of a discussion. I'm going through every bit that I did in that patient, step by step. You can see it from start to finish, how I do scars. It's really, really cool. I love it. I was watching, I was like, wow, we actually have it. We actually have that process. And it was like really cool. And I put some time to like talk through it while I was doing it too and things like that and afterwards. And it's really worth you watching. Like if you're ever wondering like what's that process, even if you don't have scars, you kind of wonder about like what people go through or like what kind of work can be involved in this, or if you want to get in this field or something like that, watch it. I'm showing you step by step how I do it. So it's like, there it is right there. I'm like showing you all the things I'm doing, how to diagnose it, how I'm doing the laser, everything. And you can learn and see it and do it really a lot better than a lot of the other people who are doing stuff like they're going to tell a patient like this to do a bunch of microneedling sessions and things like that. And you'll know like what actually works and how to do it properly. And there's people that are out of country or out of state who just with finances can't come to me, and they could see just like how that process is and what should occur for them. Tony Santana is saying, when you do fat transfer in a patient, what is the full process in actually collecting the fat? We basically go from your belly button and we usually harvest it from your flanks. So essentially we go in there with some tools, a tool that's going to give you a bunch of numbing solution. And then that numbing solution helps separate your fat particles. And then we essentially pull out the fat cells and we purify the fat. We purify in two different ways. We get the microfat, and then we also get something called nanofat. And then we inject the microfat basically to give you more support for your skin or the volume loss, the fat that you lost. And then we get the nanofat and we put that directly in the scars. That's more of the stem cells. So hopefully that helps out with that there. All right, guys, appreciate you guys so much. I will see you again